Well, so first of all, I would like to express my gratitude to Claudia and Brian for bringing me to this very beautiful country. And also, it's my great pleasure to have this opportunity to share with you our humble experience in the management of GI diseases using integrative medicine approach. I'm a gastroenterologist by training with special interest in functional GI disorders, which gave me a lot of opportunities to learn from various physicians from different backgrounds, like Chinese medicine, complementary alternative medicines, psychological intervention, and other mental health professionals. Well, because of the interest of time, perhaps I would like to confine myself to Chinese medicine in the role of in the management of GI disorders. But first, why do we need integrative approaches for GI diseases? Well, because we don't have very good and effective treatment for many GI disorders like functional GI disorders. And also for functional GI disorders like irritable bowel syndrome, well, we have this biopsychosocial pathophysiological model. That means there are more than one mechanisms that lead to the development of these disorders. And that's why there are evidence showing that there are multiple management modalities. And also, we are witnessing a rising threat of inflammatory bowel disorders in Asia. In fact, in the past 20 years, we have 300% rise in the incidence of inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Unfortunately, well, all these new medications have serious side effects. For example, biologics, they are associated with various major risks of infection, and also they are very expensive. And that's why a lot of our patients, no matter they are having functional GI disorders or inflammatory bowel disease, they all seek medical advices from Chinese medical doctors. And that's why there is a high demand for Chinese medical therapies. And in fact, we have heard from our Chinese medical practitioners friends that there are a lot of effective regimens for management of various GI disorders. Well, but after all, we still need solid evidence to substantiate the incorporation of Chinese medicine in the management of GI diseases. And although randomized controlled trials and systematic reviews, meta-analysis are not the only way for us to generate evidence for Chinese medicine, but we managed to find some solid evidence that herbal treatment, electroacupuncture, or other herbal therapies are effective in management of many GI diseases. For example, herbal therapy, we find that a few regimens have shown to be effective for management of inflammatory bowel disease. And our surgeons managed to use electroacupuncture to shorten the stay in the hospital after operation for colon cancer. And we are also searching for effective remedy for treatment of functional constipation. Unlike other conventional medicines, we find that some Chinese medical therapies manage to provide a sustained therapeutic effect on management of constipation. That means even after withdrawal of these medications, the patient remain have a persistent improvement in the bowel movement. So all this solid evidence suggests that, well, we should consider incorporation of Chinese medicine in the routine or clinical management of GI disorders. But we do encounter a lot of challenges when we talk about incorporation of Chinese medicine in our conventional management. Well, first of all, we came from two completely different systems, and with different theories, we cannot communicate easily because we share totally different jargons, and we have different approaches of diagnosis or treatment. And there's always difficulty for us to communicate because we cannot share the same language. And I must say it is not always easy to develop a team spirit with mutual respect and understanding. And certainly, well, because we need to incorporate two totally different systems, we need a good coordination of patient care flow in order to provide a cost-effective care model for our patients. Well, in Hong Kong, Chinese medicine is commonly prescribed by Chinese medical doctors, and that's why there is always concern about herb-drug interaction, and it remains one of the hurdles that prevents the generalized use of Chinese medicine in a conventional healthcare model. And last but not least, we are using two systems to treat one disease, then we should consider how to minimize the cost in the management of these GI conditions. Well, I think the first hurdle that we need to overcome is that, well, whether we are talking about the same diseases. Well, in fact, Chinese medicine is not a homogeneous or single entity or specialty. Well, in fact, unlike Western medicine, we have a standardized curriculum. All knowledges range from very solid, objective investigation or research results. But for Chinese medicine, it's largely opinion and theory basis, and we don't have, or we don't always have the good instrument to objectively support all these theories. And that's why it really depends on the schools and streams of the training when our Chinese medical doctors join hands and look after our patients. And that's why a few years ago, my mentor, Professor Joseph Song, who is now the president of our university, trying to evaluate the agreements among Chinese medical practitioners in the diagnosis of irritable bowel syndrome. Well, in this study, we involve 4 Chinese medical practitioners from different schools in different parts of China and Hong Kong. And first of all, we invite 40 patients with irritable bowel syndrome as defined by standard criteria in Western medicine, that is a room criteria. And all of these patients were evaluated by 4 practitioners in a blinded consultation manner. And we try to see the agreement on diagnosis, principle of treatment, as well as the prescription. And after that, we allow them to join and have a discussion and reach consensus. And after that, we allow another set of blind consultation for another group of 40 patients with irritable bowel syndromes. And also at the same time, we include some other patients with other GI disorders like peptic ulcer disease or inflammatory bowel disease. So, well, I don't mean to teach you the theory of Chinese medicine, but basically these are all the syndromes that have been associated with the symptoms mentioned in irritable bowel syndrome. For example, the stagnation of liver energy, well, deficiency of spleen energy, and also wetness and heat in the spleen and stomach. And we have different syndromes of Chinese medicine that describe the symptoms of irritable bowel syndrome. So to tackle these syndromes, they also have different strategies of treatment. For example, to regulate the hyperfunction of liver, or to promote the energy and strengthen the spleen. So all these are Chinese medical management strategies for different syndromes. And you don't need to learn Chinese for these remedies, but basically they represent different Chinese medical formulas that are commonly used in the management of irritable bowel syndrome like syndromes. Well, we found that in fact the agreement among Chinese medical doctors from different streams are actually not that satisfactory. You can see that the agreement is generally a little bit more than 50% only. Well, but we find that if they have chance to meet and discuss among themselves and then they reach a consensus, well, in fact, in the second phase, they reach a very satisfactory agreement. That means if we really want to incorporate Chinese medicine in the management of GI disorders, the first step perhaps is to gather all our colleagues from Chinese medicine and have a preliminary training or consensus agreement reached by all these doctors before we allow them to join in the management algorithm of management of GI disorders. So let's move on to the management. Well, for taking IBS as an example, well, this is a very well time-honored ancient Chinese formula that have been commonly used for the treatment of diarrheal type illness. And this is an early study that showed that there is a significant improvement in the bowel symptoms of IBS with the use of this herbal formula. Well, but interestingly, well, when we visit the efficacy of this formula, we found a very interesting observation. Well, first, let me show you a study from Australia, which involved more than 100 IBS patients with diarrhea, and they randomized to 3 different treatment arms. The first one is placebo, the second one is individualized Chinese medicine, the third group is a standard Chinese formula for 16 weeks. Well, although initially both individualized and standard treatment reached significant improvement in bowel symptoms, but well, after 3 more months after withdrawal of all the trial medications, only individualized treatment group, well, has achieved a maintenance of improvement after completion of the treatment. Well, suggesting that, well, adopting the practice of standardization like Western medicine may not be the best strategy for management of IBS using Chinese medicine. And individualized treatment is still the mainstay of treatment strategy when we talk about Chinese medical treatment for functional GI disorders. Well, when we use the similar formula in Hong Kong, again with a similar number of patients with diarrheal type irritable bowel syndrome, and we randomize them to placebo and standard treatment, well, unfortunately in this study we failed to see any significant difference or advantage with the use of herbal formula as compared to placebo in the management of IBS. So, well, again, our study lends further support to the notion that, well, individualized treatment is still the most important hallmark in the management of GI disorder with Chinese medicine. How about acupuncture? Well, this is a very important landmark study, which is a meta-analysis evaluating the efficacy of the use of real acupuncture versus sham acupuncture. Well, as you can see, well, unfortunately, there is no clear advantage or superior efficacy with the use of real acupuncture as compared to sham acupuncture, suggesting that, well, we don't have a solid evidence substantiating the use of real acupuncture in the management of irritable bowel syndrome. Well, however, perhaps this may means that the patient selection may not be ideal in these trials. And well, 3 years ago, we published another study which set out to see the mechanistic aspect of the effect of acupuncture on the central pain processing in patients with irritable bowel syndrome. So we invite 30 IBS diarrhea patients and randomize them to true acupuncture versus sham acupuncture. And we evaluate their central pain processing mechanism using functional MRI brain. And we find that electroacupuncture actually, well, have a positive impact on the brain activation at regions like insula as well as the nucleus of right thalamus. And we find that these acupuncture-mediated pain modulation in IBS patients, well, are mediated through the modulation of serotonin pathway in insula. And also, well, acupuncture has major effect on the mood and affect regulation in response to nauseous visceral stimulation. Well, suggesting that we may want to confine to patients who have IBS as well as comorbid psychiatric conditions like anxiety disorder. And I would also like to show you another meta-analysis which evaluates the efficacy of acupuncture as compared to the other complementary and alternative medicine. Again, you can see that, well, when we use acupuncture to compare with other modalities of CAM, we find that in general, acupuncture have superior efficacy in terms of IBS symptom improvement when it is compared with medication or psychotherapy, and you can see that, well, acupuncture as an adjunct treatment to all these complementary alternative medicine may still give additional advantage. Well, so how can we analyze all these observations? Well, perhaps, well, we may need a better selection of patients for acupuncture treatment for management of IBS, and also, well, acupuncture may still act as a good adjunct when it is used in conjunction with other complementary and alternative medicine. So because of this, we are now embarking on another trial which focus only on patients with comorbid irritable bowel syndrome and generalized anxiety disorders. So we use these standard acupoints, and we want to see if a better selection of patients with comorbid IBS and anxiety disorders may have better response to acupuncture treatment. So we will randomize them to real acupuncture versus sham acupuncture. And after 10 sessions, in addition to IBS symptoms, we also evaluate the anxiety symptoms, quality of life, and also we want to see if there's any positive impact on the brain activation using functional MRI. Well, we don't just confine ourselves to incorporation of Chinese medical practice. I think in our center, we also serve as the platform for patients to try other pure compounds that are not conventionally used in daily clinical practice. I'm very glad to share with you this study, which is recently published in a major GI journal, and this is a multi-center study in Hong Kong and also a few centers in Israel. And we use curcumin, which is an extract from ginger, and we try to see if curcumin can have any additional benefit when these patients are treated with mesalazine, which is the standard treatment for mild to moderate ulcerative colitis. So in this study, we recruit 50 patients with mild to moderate ulcerative colitis who failed to respond to conventional maximum dose of 5-ASA. Well, normally these patients will need steroid or even escalation of other medical treatment. But in this trial, we want to see if curcumin can avoid the use of other higher level treatment with more side effects or more or higher drug cost. And in fact, the results are very promising, and we find that about 50% of patients achieve clinical remission when they are randomized with curcumin on top of 5-ASA, compared to 0% in those placebo-treated group. And also we see a significant high response rate and also endoscopic remission rate as compared to those patients who are put on 5-ASA alone. Well, I think these results, frankly speaking, is too good to be true for me. But I must confess that this is a multi-center study, and we managed to see this significant difference. And that's why now we are planning for another study and see if curcumin can help patients to be free of 5-ASA completely, and see whether curcumin alone can maintain a good clinical and endoscopic remission in patients with mild to moderate ulcerative colitis. So, all these treatment modalities are evidence-based, and we want to develop a platform that we can deliver all this evidence-based integrative care to our patients with GI disorders. So 2 years ago, we set up this Hong Kong Institute of Integrative Medicine. This is the only academic institute of integrative medicine in Hong Kong, thanks to the very generous support from our patrons, and we managed to convert a hospital ward into outpatient centers that deliver integrative care for patients with various medical illnesses. And we adopt a multidisciplinary model. So we develop teams for each particular areas. For example, for patients with neurological disease like stroke or multiple sclerosis, we have a designated team of neurologists, Chinese medical practitioners with special interest in neurological disorders, as well as other paramedics. For GI disorders, we also have another designated team, which consists of gastroenterologists, surgeons, and Chinese medical doctors, as well as GI specialty nurses. And all these patients, before they are deemed eligible for integrative care, they will be assessed by our integrative nursing coordinator, who receive both Western and Chinese medical training. And during the initial assessment, during the first week visit, well, both the Western clinicians and the Chinese medical practitioners will see the patient at the same time and see if there's any emergency condition or urgent condition that we need to tackle before they receive the Chinese medical treatment. Because of the individualized nature of Chinese medical treatment, we respect the independent and individualized Chinese medical treatment, and as a Western clinicians, will help monitor the safety and adverse events experienced by these patients. And well, we arrange follow-up consultations, and sometimes the patient need another joint consultation, so we will see the patients together and see if there's any significant improvement with integrative model. So I would like to summarize my talk using this slide. And in Hong Kong, we have a very heavily subsidized public healthcare system. So the government will support the operation of this functional GI disorder clinic and also the nurse-led GI clinic. And our patients, for example, with IBS or functional dyspepsia, they would receive blood tests and also endoscopy, which exclude structural pathologies. And after that, these patients will be seen at the nurse-led clinic, which will have a lot of things to do for these patients. We screen for psychiatric comorbidity because it's very common in patients with functional GI disorder. We use a standard questionnaire that is a PHQ-9 questionnaire to screen for patients who are suspicious of having anxiety or depressive conditions. And our nurses also have training in Chinese medicine, so they offer nursing assessment for this patient and see if these patients are suitable for further management by Chinese medical doctors. They are also trained with, also be equipped with some counseling skills, and they also provide nurse-led cognitive behavioral therapy and relaxation training. And well, just in case they need, they are suitable for further trials, this is also the platform for us to recruit, to invite these patients to participate in our trials. And for those patients who really want Chinese medical treatment, or they want a more intensive management with mind-body medicine, this will be done at the Hong Kong Institute of Integrative Medicine. And certainly some of the patients with very overt features of psychiatric conditions like anxiety or depressive conditions, they will be referred to a special clinic, which is known as a functional GI disorder clinic, which is cooperated by gastroenterologists and psychiatrists. And some patients still need further mental health support, so we have a clinical psychologist ready to support these patients at either the nurse-led clinic or functional GI disorder clinic. And definitely dietary intervention plays a very important role in the management of functional GI disorder. We are talking about the low-gluten diet, low-FODMAP diet, and that's why for more personalized patient-centered intervention, they will still be referred to dietitians if they are not adequately managed at the nurse-led clinic. And we also set up online platforms, and we also have patient support groups, so we can run group therapies like group CBT or group hypnotherapy or mindfulness in this platform. And many of these patients manage to have significant improvement in both symptoms as well as the functional aspect, so they will be referred back to the primary care so that we can keep a light weight at this level. And well, for government subsidies, these two platforms are subsidized by the government, but for more intensive management like this, well, patients will be expected to pay with the support of medical insurance or pay out of their pockets. So with that, I would like to finish my talk. Thank you very much for your attention.